Afternoon, everybody. The Economic Development Corporation. I'm going to kick us off today and then hand it over to officials with the Erie County Health Department. So first and foremost, I want to give my thanks to the staff here at Erie County Health Department. Specifically Heather Haynes, Maddie Davis, Abby Schwanger put a lot of effort into this presentation, and we thank them for their time in a particularly busy moment. And also to our Health Commissioner, Pete Shade, for encouraging that kind of community outreach and forward thinking with our community. So today's agenda, we're not going to spend a lot of time on the changing Ohio policies. I think most of you are up to date on those facts, but we are going to focus on your workplace, tips and settings, and advice from health professionals. We will save some time for Q&A at the end, and we encourage you to use the chat function and the question and answer function that you find at the bottom of your screen. We have gotten a few questions. Attendees are in listen-only mode, so you shouldn't be able to, sound should be muted from your own audio on your computer. With that, I also wanted to thank the various business groups that have helped push out the word about this webinar. Our communities, all of these organizations are here to be of assistance in pretty trying times. And so keep them in mind as potential resources. Send them questions, send them suggestions. I know they're a responsive group and we are here to help. So the landscape today we know is changing quickly. Shutdowns of various types of business functions. I think the majority of the people on the call are in operation in some kind, so we're going to presume that as we give you guidance. We asked for you all to submit questions in advance, so we'd be sure to answer what's top of mind for you. And I would say we got a number that were essentially what could be next and how long would these shutdowns persist. I'll be upfront that we don't know the answer to those things. We too are judging the situation daily. I know the governor's office is doing so as well. What we have been told from a business perspective is try to use a cadence of 2 weeks for your planning. And then within those 2 weeks that you're planning for, have run a lot of what if scenarios. So what if we are closed tomorrow, next week? Who is essential from our team and how do we plan for our operations? So with that advice, we do have a toolkit that I'll mention at the end of the webinar that could be useful links and thought-provoking questions to think about for your business. What we do know and what we can control is essentially the information that we have in our hands. So we want to be of assistance with that. And what you can control is hopefully help abiding by the health recommendations that are coming out. I think that's where we can make an impact for our community, and we want to make sure that our workplaces are staying healthy and safe. And I know everyone participating in this webinar has that top of mind as well. So thank you for that energy and that time. And with that, I'm going to pass it over to Abby Schwanger from the Health Department to get into the meat of the presentation. I can't do your video though.
Hi, this is Abby Schwanger from the Erie County Health Department. And I'm here to talk to you a little bit today about what's going on with COVID-19. And you also might have heard it called the coronavirus. And so coronavirus, it's one of a family of diseases that are zoonotic, which means they come from animals and they can jump over to humans. And that's what makes them really dangerous, is that because they are zoonotic diseases, our bodies don't recognize them as a virus that they're used to seeing. And so our bodies don't have the immunity to them that we have to other viruses, such as other types of influenza. Of course, we all are seeing on the news about about
Speak up. I
the
can't hear you.
COVID-19. And the illness, it ranges from mild to severe. Some people are even completely asymptomatic. So there's a lot of people who are not showing any symptoms whatsoever. And then it can also be very, very severe. We know in individuals with who are elderly or who are immunocompromised, it can even result in death. And it's much more serious than influenza. It's about twice as infectious as our common influenza, and it's about 20 to 30 times as deadly as common influenza.
They're having that.
One of the really important things for everybody to know and understand is that right now testing is very, very limited. There are a limited number of tests that are available to the state and throughout the country as well. And so what we have to do in our community is really limit testing to those individuals who are inpatient and have very severe illness. And that's so that our healthcare providers can understand what they're working with and that they can provide or use the proper PPE or personal protective equipment to protect themselves while they're caring for these patients. And also, we are testing our healthcare workers and first responders who potentially have been exposed to the virus. And again, that is to keep our healthcare workers and first responders healthy during this time, because they're the ones that are going to really get us through this. And so it's important that we prioritize their health. What's important to know also is that actually getting tested for the virus and being diagnosed with the virus has absolutely no impact on treatment. And so there is no treatment currently approved, or there's a number of different things that are being tested, but nothing has been approved or is proven to be a cure for this novel coronavirus. And so treatment is simply supportive at this point. And that's why it's not going to change the way that we treat the patient. And so anybody with mild or moderate symptoms need to self-isolate. And that means staying at home, not leaving the home, and if possible, staying inside their own bedroom with a bathroom if it's possible in their home. Individuals who have mild or moderate symptoms and they're able to stay home and ride it out and get through that illness, they need to stay home until the respiratory symptoms have completely resolved, until they have been fever-free for at least 72 hours without the use of fever-reducing medications, and it needs to be at least 7 days following the onset of symptoms. And so once individuals have met all of those requirements, they are able to leave the self-isolation. And that's going to be applicable to you folks in the workplace. And so if you have somebody who is sick, what we're doing is we are encouraging people to act as though they have the virus. And so because there's no testing, if you are showing symptoms or if one of your employees is showing symptoms, they need to behave as though they have the virus. And so they're self-isolating until they met all three of those requirements that I just discussed. If individuals have severe symptoms, only then are we suggesting that they call the emergency department and get further direction from the emergency department prior to going in. And we also ask that people don't call 911 and don't rely on EMS and ambulances to get to the emergency room if they can get other transportation to the ER. If they are not able to get that transportation, and if it's very severe, please, of course, call 911, but make sure that those 911 operators are told exactly what the symptoms are so that our first responders can be made aware of what's going on, and that they can protect themselves when they answer that call. Again, it's going to be so important that we keep our healthcare and first responders safe in these types of situations. Abby mentioned earlier, we don't know how this is all going to play out. We don't know how long it's all going to last. We have gotten information from the governor, and I think we're really lucky with Mike DeWine. He's been very proactive in the Ohio Department of Health, in really prioritizing public health. And I know that that is no comfort to many of our friends and partners in the business sector, because it's very challenging for those folks. Governor DeWine did order that all of our bars and restaurants that serve patients in indoor settings and have seated service, that they no longer serve customers inside their businesses. And so it's going to be a time where we all have to come up with new creative solutions. In healthcare, we're coming up with new creative ideas and solutions, and other various businesses are going to have to come up with creative solutions. And we've already seen a lot of our restaurants really transforming their business into how they want to provide delivery service and orders and that sort of thing, pick up. So it's going to be important that we just use our creativity to try to get through it. But as far as how long it's going to go, it really just depends on how this continues to progress. If we look at what has happened in other countries, and if we look at what's happening in other states within our own country, we can guess that the measures are going to become more restrictive before they become less restrictive. We've already seen in California that they have closed all non-essential businesses, anything that is not life-saving, including grocery stores. Grocery stores are considered essential and life-saving businesses, but all other businesses are closed. And so the more that we can get people to follow the restrictions and really continue to social distance people, we can mitigate the spread of the virus and reduce the spread, the quicker we're going to be able to get out of these restrictions. And so the longer that we are allowing the virus to spread and that we're being careless, then these restrictions are going to go on longer and longer. And so that's where, we're here to really talk to you today about making sure that we can keep everybody safe. We, of course, want to keep businesses open where it's feasible and where it's healthy and where it's safe for employees to work. But we need to also start thinking about worst case scenarios. Worst case scenarios being perhaps, the virus, somebody in your organization tests positive, and then, we need to cease operations at that point. Or perhaps the order comes from the governor where, we need to cease operations at other types of businesses. So it's going to be important that you plan ahead and really think about what's going to happen in the future and how we can plan to really follow these guidance. We know that for mass gatherings, they have been limited and restricted to less than 50 people as per the governor, and those people need to have enough space, if it's indoors, especially indoors, to at least 6 feet apart. And so, that is what is restricted to. Is it a good idea to have 50 people in a one room? I don't know, but those are things that you're going to have to make. We can't tell you everything that you need to do. We rely on people to use their judgment, use their discretion to make those good decisions and to keep their employees and the community safe. We know that President Trump has mentioned that less than 10 people would actually be ideal. And I think that is probably closer to what we think as well. The virus spreads from person to person. Of course, it came from animals. It's a zoonotic disease, but once it has spread to humans, it now spreads person to person through droplets. And so we know that people can become infected by being close to somebody and by having somebody, if a person is sick and even they're breathing out, you may not be able to see those droplets, but people are breathing out droplets regularly when they're speaking and breathing, and you can be exposed to them in that way. And then when those droplets are breathed out, they will actually land on surfaces as well. And so contaminated surfaces, when they're touched, those germs and the virus can travel to your hands. And then if you touch your face, you can self-inoculate from touching that virus and spreading it in that way. Because it's a new virus, we don't know a lot about exactly how long it lives on which surfaces, but it's a good idea to make sure that we're disinfecting those surfaces regularly. And you can see the social distancing graphic here. It's just a visualization of how you need to stay 6 feet away from people, because when they're breathing out and sneezing and coughing, then you can become infected even if you're very healthy. So for our employees, what do we need to do to make sure that we are reducing the exposure risk to the people that we're working with? Number one, we have to plan. We have to have a preparedness plan. And part of that plan is identifying exposure and health risks for employees and trying to find ways to mitigate those risks. Now that can include creating new policies, practices. We can reduce the risk of transmission by letting people work from home. Can they telecommute, use their computers, sign on like we're doing today with webinars, and talking to people in that way? Can we stagger shifts? I know a lot of you are working in places where it's not, you can't sign in on a webinar. You're actually, manufacturing or doing something that it can't be done from home. And so can we then stagger shifts? Also reviewing our human resources policy. So we need to make sure that those policies are non-punitive and that they actually encourage people to stay home when they're sick. We know that a lot of employees will show up to work sick because they're not going to get a paycheck, or they're going to get in trouble. They're going to get written up if they miss a day of work. And we need to make sure that employees are not worried about that at this point. When it comes to public health, and in this situation, it's going to be very important that if anybody has symptoms, that they must stay home. And we need workplaces to really, really push that for their employees. Also, identifying what essential business functions can be shut down at this time. If we need to reduce the number of employees, which ones are essential, which ones are non-essential, and planning for that continuity of operations for essential business operations. It's going to be important that businesses really, again, reinforce the messages that you're hearing from the health department and from our leaders at the Ohio Department of Health and the CDC. Stay home when you're sick, and really pushing cough and sneeze etiquette and hand hygiene. We do have some printable resources on eriecohealthohio.org. And you can print those off and hang those in throughout your organization, and to spread that information and knowledge about really protecting people and keeping your germs to yourself and washing your hands. Also, just making sure that you have the right supplies that are necessary. We're telling people to wash their hands. Let's make sure that we have plenty of soap and hand sanitizer, and tissues, things that they can do to stay safe and stay healthy. And that's going to really keep your staff and your workforce healthy and strong. Also, we're going to come into the situation where people are going to begin getting sick. And so how do we identify and isolate sick employees? So again, with your policies, make sure that they're up to date, make sure that they're flexible, and make sure that they're non-punitive, so that somebody can feel comfortable calling in and telling you that they're sick and they're not coming to work, and that they're still going to have a job when it's all over. I know that this is a really, really challenging time for people. And a lot of people are losing jobs, and a lot of businesses are on edge, and I get it. It's very challenging. So trying to help to reassure our employees and allowing them to take that sick time so that they don't get others sick. That's really important. And encourage them when they wake up in the morning, hey, take their own temperature at home. Let them, ask themselves, am I feeling sick today? Do I have a cold? Should I go to work? Should I not? Again, we tell people, assume that you have it. So if you wake up and you have symptoms that could potentially be that or a cold, assume that you have it and act as though you have it. And that's how we can prevent spreading it to other people. And another note is that we really do not recommend requiring a note from a physician. So at this time, physicians' offices are very, very busy with people who are sick, and it's not best to have people who are infected with COVID-19 visiting physicians' offices and potentially infecting more people. There's no benefit to seeing a physician if a person has mild to moderate symptoms because there's no treatment at this time. And so requiring a note from a physician causes a lot more issues with our healthcare system and really doesn't accomplish much. And so we really, really strongly suggest that you do not require a note from a physician if you have an employee that is sick and that is staying home for suspected COVID-19 symptoms. And then routine environmental cleaning is very important. And so having your staff be aware and just upping the ante when it comes to cleaning the areas that everybody's touching: doorknobs, door handles, desks, tabletops, counters, workstations, anything that people are touching. We need to make sure that those are disinfected regularly. Now, I know that there's been a run on the store for, wipes and different types of cleaning agents, but regular old household bleach is a great go-to for disinfecting. And what you can do is you can mix 1/3 cup or 5 capfuls, 5 tablespoons of household bleach in 1 gallon of water. You can put it in a spray bottle, spray down surfaces. You can use a clean washcloth with that and wipe down surfaces, allow them to air dry, and that's going to disinfect those surfaces. That's for hard surfaces. We know that the virus can live on hard surfaces for some time. Don't quite know how long. There's been some research done, but again, because this is a new virus, there is very little research out there. But we can guess, based on the way that other types of viruses behave on hard surfaces, that it is going to linger around for a little while. So we do want to make sure that we are disinfecting those surfaces very, very regularly. One quick note for that household bleach solution, that needs to be discarded or make a new batch every 4 hours or so. So we're not going to, keep the same old, dirty bleach bucket sitting around for a week. It needs to be changed every 4 hours to make sure that that stays effective in killing those viruses. So for upholstery, cardboard, other types of non-hard surfaces or porous surfaces, again, we don't quite know how long they live on these surfaces, but you can use other types of EPA-approved disinfectants, like a Lysol spray, perhaps. Not bleach, that could ruin some of those products, but you can use those and spray those on your upholstery, cardboard, and disinfect surfaces in that way. Do not mix chemicals. That's a really important note to make. Bleach mixed with ammonia or anything else, hydrogen peroxide, these types of chemicals, if they get mixed together, they can create some very, very harmful and noxious gases, which the coronavirus will be the least of your concerns at that point. So please don't mix chemicals, and make sure if you're using one cleaning solution to stick to that cleaning solution. We had some questions early before we did this presentation or created the presentation was, can you make your own alcohol-based hand sanitizers? And our answer is no. The reason for that is that alcohol-based hand sanitizers need to have a certain level of alcohol, or a certain percentage of alcohol. That's 60 to 95% alcohol. And when you're making those from home, a home chemistry experiment, we can't guarantee, and you cannot guarantee, what the percentage of alcohol is going to be in those products. And we don't want you to have a false sense of security by using a product that is perhaps not effective for killing the virus. And so if you run out of alcohol-based hand sanitizer, good old soap and water is going to do a great job in cleaning your hands and keeping your hands clean. So we do recommend soap and water even before alcohol-based hand sanitizers. So I know there's a lot of question and a lot of uncertainty now also about this suggestion or instruction from our governor, which recently came down, where he asked all of our employers who are still open and still operating to begin taking employee temperatures. This is a challenge. We know that. We know that there is a shortage of thermometers in the community. And so it's something that is an issue for a lot of our businesses that are open. We do have some suggestions and things so that we can make sure that you're doing this safely to comply. Number one is to restrict access to the building through temperature access points. So instruct all of your employees to enter at just one or two entrances where they can have their temperature taken. And that's going to allow you to be able to monitor who's coming and going from the building. And you can ask those questions when they come in. How are you feeling today? You know, not just getting the temperature, but hey, do you have a cough? And really get them out of there at the first signs before they enter the building and infect the entire building. Make sure that if you have staff that are working these access points and taking employee temperatures or assisting with that they are washing their hands and using gloves. So that's something that we have to keep in mind so that we do not cross-contaminate. Please use thermometers that are specifically manufactured for personal use. And so no meat probes or cooking thermometers, things like that. Use personal use thermometers that are meant for humans. And if you need to, it works best if you have multiple thermometers that you can rotate so that you can disinfect them in between and keep the line moving through the door. We have had people that decided to bring thermometers from home if needed. And so bringing thermometers from home, if you have multiple people that can do that and you can keep track of those, disinfect them in between use. And what you're going to do for disinfecting for all of our food service operators, this is a process that you are very familiar with. It's already the process that you use when you're cleaning bar glasses or any type of dishes in a food service establishment. It's the regular old wash, rinse, sanitize procedure. And so you're going to wash the thermometers in a bowl of hot soapy water. You can have a couple of bowls sitting there on a table by the door where employees are entering. You're going to rinse the thermometer in a bowl of warm, clean water and then sanitize it in a sanitizing solution. This is the same solution that I mentioned earlier with the bleach. So 1/3 cup of bleach or 5 capfuls of bleach in a 1 gallon of water. You're going to dip it in there, let it sit for a little while, and then pull it out and let it air dry. And it needs to air dry on a clean paper towel for 1 to 2 minutes. And then this is why it's going to be good to have multiple thermometers that you can rotate through to keep that line moving. Alternatively, we've had employers who've mentioned that they are having their staff take their temperatures and log them at home. And so if that's a process that you can come up with a process that will work for you and your organization, they can take their temperature at home and log it. That is also a procedure that you could do to try to meet these guidelines that have been given to us by the governor. So now into some more specialized information about different types of businesses and sectors. So in construction and manufacturing, if you have an outside site, an outside construction site, that's certainly going to be better than having people together in close quarters inside of a building. For manufacturing, we want people to be at least 6 feet apart, as I mentioned before about those droplets in the air being infectious. And so making sure that staff in manufacturing establishments are 6 feet apart is going to be really important. If you have tools that they're sharing, those tools need to be cleaned regularly in between employees. You can use that same bleach solution that we talked about earlier, or other types of sanitizing wipes, including handles of machinery and different types of gears. If people are driving a forklift, making sure that those inside mechanical parts are wiped down in between users. it would be a great idea to increase the use of mobile hand washing stations. And so if you can implement mobile hand washing stations and have them available in to your team and staff throughout their workplace, that's going to be helpful to help people be able to wash their hands in between work. Carry hand sanitizer. So if you make sure your staff is armed with some hand sanitizer on their person so they can use that regularly in between touching different items and sharing items, that's going to be helpful. Staggering breaks so that people are not all working together and breaking together, so that we can have more space and spread out, and requiring hand washing at those breaks. And then just a last note that, right now, the state of Ohio and the entire country as a whole is really experiencing a shortage of PPE. So personal protective equipment is something that's a huge challenge. And for our healthcare providers, particularly N95 masks are in short supply. And we're expecting to see more cases, and the number of cases of COVID-19 is just going to continue to increase for a while here. And so it's going to be important that we are able to find more N95 masks. And so if you have a business that you have access to these, if you have a supply of N95 masks that you're not using, your business is shut down or slowed down significantly, and you'd be willing to help to supply some of our healthcare providers with these masks, please contact Tim here, and the number is on the bottom of this slide. And now I'm just going to turn it over to Heather Hayes. She's a sanitarian, and she's going to give you more information on retail food establishments.
Hi, everyone. I'm going to be talking a little bit about our licensable facilities here within Erie County, one of them being our retail food establishments. These are our gas stations, our convenience stores, and our grocery stores. Many of you are utilizing these facilities at this time to stock up all the supplies that you need at home. First and foremost, if your customer self-service areas are available in these machines, we strongly recommend that you cease these operations. This is seen in the fountain pot machines, the slushy machines, and the hot dog rollers. So anything that the customer touches a knob and then gets the product for themselves, this causes a lot of germ turnover with their hands being the vehicle of transmission. Second, if you have any exposed foods, you should be pre-wrapping those. And when you pre-wrap in the facility itself, you need to have the proper label attached to those items. So that includes the common name of the item or the title of the item. It includes the ingredients in descending order by weight if it's made up for more than 2 ingredients. You also need your city, state, and zip code of where your establishment is located, and the net weight on every single one of these packages. This item could be as simple as the apple. Since we do normally eat the rind from that apple, we want to give those a pre-wash and then let them air dry and then package those up. Third, we always are encouraging and recommending and establishing that you need to have social distancing in our checkout lines, and you can do that by using barricades, by using ropes, by using cones, by making announcements over the loudspeakers every so often. I know I went into an establishment yesterday to do a complaint inspection, and there was literally people overtopping each other in the lines. We need to recommend, we need to enforce that the social distancing needs to occur. And again, that is 6 feet between each patron. The last important thing too is for cleaning and disinfection. This includes our cash registers, our mice that we are using to ring people up. If you have the ability to discontinue the self-service areas, that would be a strong recommendation since everyone is touching those, or clean those after every patron. The doors to the entrance of the buildings, those should also be wiped down very frequently. Anything that is commonly touched by either your employees or your customers should be continuously cleaned. The Next thing is a lot of people want to use gloves in their establishments. Gloves are typically used for handling ready-to-eat food items. If you are using gloves in the prevention measures for COVID-19, you need to still use those appropriately and properly. Because you're using gloves does not mean that your hands are protected from contamination. There's always a question: if you are using gloves, then are you touching your face more often, or are you readjusting those gloves? Are the gloves properly fitted? Goes into a whole depth array of questions. Gloves should be used for the healthcare professionals, since again, we do have a shortage of our PPE. We are going to encourage that everyone has limited hours. This is to help shut down the establishment, clean and disinfect in between each shift or each hour of close. We also love the recommendation that some operations are taking the opportunity in the very first hour or two of their businesses opening to help the elderly and give them precedence over the general public. The elderly are some to be concerned with getting COVID-19. We also do not want to topple over them in the grocery lines. We don't want to be subjecting them to fights, etc. We want to, again, clean and sanitize carts, hands, and doorknobs on your cars and your homes before and after going out. So after you have gone out to the grocery store, you've gotten what you needed, you're touching the door to the store sometimes, you are touching your car door, you are touching the door to your home, you're touching the knob to get into your garage door. All of those things should be sanitized. Again, you'll hear us say it multiple times. Social distancing should always be practiced in checkout lines and throughout the stores. Again, act as if everyone has this virus. Now is the time to have a personal bubble and to use that personal bubble. When getting items from the store, you should be going in, having a list already made up, having a general whereabout of where these items are. I know some apps do have store locations for their aisles in which the foods are located. So use those, get a general census of how long you're going to be in the store, quickly get in and quickly go home. There should be no continuous shopping. You should not say hi to your neighbor. You should not talk about your life story. Go to the store, get what you need, and then go back home. We want to encourage eliminating shelves being wiped out so that supplies can be passed along to everyone, as we are all in this together. So maybe eliminate some items to limiting numbers. So toilet paper, I have seen, has been limited to 2 packs per person or per household. Same with meat, eggs, bread, sanitizers, hand soaps, bleach, etc. Again, for the promoting of social distancing 6 feet or more, this is especially important in our FSO establishments, or these are our food service operations. As you know, you cannot go in and dine in a restaurant. This is restaurants, fast foods, mom and pop stores. You want to order the food online, you can call ahead, or you can go in, place your order, and then go right back to your car until the product has been serviced for you. We do not want to see an establishment having a large group of people waiting inside of their restaurant. If they need to wait, please advise them to wait outside in their cars. A definite suggestion would be to give them specific times for pickups. This will help eliminate those long lines. If your restaurant establishment normally has people sit and eat as a camaraderie, then remove the chairs, block off areas, do anything you need to discourage the surrounding of customers. Again, no eating inside of the restaurant. This is a governor's order. Carryout and delivery. I know we have gotten a couple of questions prior to this slide in regards to this. Carryout and delivery is a safe practice. Many restaurants already established this through their drive-thrus. As long as the food is cooked to the minimum internal temperature, which varies depending upon your product. So our fruits and our vegetables that are going to be cooked for hot holding to be served need to be at least 135 degrees for 15 seconds. Our whole meat products and our fish and seafood is 145 degrees for 15 seconds. Any of our ground red meats, so that's ground burgers, that would be 155 for 15 seconds. And then our chicken or our poultry, any of those items need to be cooked for at least 165 degrees for 15 seconds. If you make the minimum 165 for 15 seconds for all of your food, you will not go wrong. When you are servicing this food, you need to get it out the door very quickly. We do not want the foods to fall below 135 degrees. And the cold food that you are serving to your customers needs to be 41 degrees Fahrenheit or below. Again, carry out, delivery, and pickup food orders are a safe practice. Minimize the number of people waiting inside your establishments. I have seen where people have put posters up that if they are displaying any of those symptoms, they cannot come into the establishment. A lot of people are ordering deliveries or through the social apps where you can go to the app, place your order, and then a third-party driver will pick up your food and deliver it dressed to your house. We encourage those types of call-in orders, and we encourage deliveries and drive-thrus. Some drive-thrus that mom and pops can take advantage of are a call-ahead order and then coming out to the car, driving through the parking lot, delivering the food right to the window, going back into the store. This minimizes person-to-person contact inside your restaurant, and then you know who is touching that doorknob. But again, sanitize those doorknobs. So it'd be considered your curbside pickup. If you have an overabundance of pickup orders, a suggestion so you are eliminating person-to-person contact again is to use a shelving system where you have orders in ABC order, so section A through B, C through D, etc., etc. Place the food order in the correct ABC order from the person's name. Give them a designated time to pick up this food, and then they can come already prepaid, pick up their food, and then leave right away. So there is no handing it to the customer doesn't have to wait in line, and there's no chit chat. Another, like I talked about earlier, is the use of mobile apps for food delivery services. For your grocery stores, there's also mobile apps that will deliver. You just need to call or go to the app to make sure that they do have the delivery of groceries. Pickup is also a hot item right now for your grocery stores. And we encourage these grocery stores and the deliveries to maybe lessen your delivery fees at this time, just so that people can get the food if they do not have the items to make it at home. And then last but not least, every restaurant, every grocery store, gas station, etc., you need to monitor your employees' health. This can be done through temperature checks, doing walkthroughs. If anyone displays any shortness of breath or excessive coughing, then they need to be sent home right away. You need to close the area where they're working, and then you need to sanitize that properly. There's been some questions about hotels still being up and running. I know quite a few hotels have voluntarily closed. Cottages and bed and breakfasts are normal establishments that we do not license if it's less than 13 guests. It is an exemption through the state of Ohio. However, we do recommend that you reduce this number to 10. You want to, again, promote social distancing. So if you can put them in every other room or every 2 rooms, we highly encourage that. Maybe block off the rooms that have the shared doorways. Promote social distancing by closing off the communal areas. So our grab and go breakfast nooks or our little seat-in areas in the front of the stores or in front of the hotels. We want to block those off. If you are having your continental breakfasts, again, it is a strong recommendation that all buffets and customer self-service areas are closed. You can have an order form and then deliver it straight to the room, or you serve the guests the food that they need as a pre-plated option. Proper disinfection should occur between all patrons in every single room. This includes the TV remote, the TV itself, the light switches, the countertops, the doors, the dressers, the beds, etc. When you do laundry, you should not shake your laundry. Try and gather as much as you can in a tightly knit fashion and then go right away to the laundry service. Last thing I did want to mention is about marinas. We had a couple of questions about marinas and campgrounds. For your marinas, a lot of patrons are coming to the Erie County area, especially if they are for their boat preps, because I know they're trying to get it in the water by April 1st. Discourage this. Discourage them coming. If they have a question or an issue about their boat, use video conferencing, use chats, use emails. Just eliminate person-to-person contact. They should not be going through your buildings, going to their boats, washing as needed, leaving, etc. For campgrounds, we strongly recommend for the tent setups that you are doing 1 tent per site. For the hardened campers, the travel trailers, these distances should be properly above 6 feet anyway. However, campsites where they have the campfires, we strongly again recommend social distancing of 6 feet or more. For our pools and our spas, our chlorine levels should be 3 to 4 parts per million. So it's above the normal 1 part per million, and this is of free chlorine. For bromine, it should be 3 parts per million or above. Follow the CDC guidelines should you have any diarrhea or hardened poop for the accidental procedures.
All right. So that was a lot of information that we covered in a short amount of time. First thing to note is that we are planning on publishing this recording so you can reference back to the comments that you heard today about your settings. And also the slides will be made available to all participants. But I did want to address a couple additional questions we got in advance, less related to operating practices and more related to business hardship or employee hardship. So had a question in advance about unemployment and how that will work and how to get information about it. So our office, Erie County Economic Development Corporation, did create some toolkits that definitely has a link to where you can obtain the forms for unemployment should your employees be laid off due to a decline in production. Also had a specific question about tipped employees and the challenges with their unemployment claims, as many of them are claiming in cash. The minimum weekly payment for unemployment is $134 a week. Tipped employees do have the ability to contact Ohio Means Jobs and the Department of Jobs and Family Services and try to revise their history, but that is a process that they would need to go through to address. Had a question about whether employees who were sick were eligible for unemployment, and that was recently passed into law by our government that yes, employees who are in quarantine due to illness or suspected COVID are eligible for unemployment claims, but I would also recommend that you check with your employer and whether it makes more sense to make a short-term disability claim and work through your human resources department to evaluate that. And then finally had some questions on financial hardship for businesses themselves. As many of you have probably seen, there's been a lot of publication this week as Ohio was approved for the National Disaster Relief Loan Program. These are low interest loans through the Small Business Administration, and they are designed for working capital, which, as most of you know, is pretty unusual for lending. But it's meant to cover your accounts payable during this hardship time. So what I want you to take away from this is that we have created toolkits at our office on each of these topics. Operations, so a lot of the content that you heard today about how you keep your workplace safe and clean. Hardship, so things like unemployment claims and the small business loan that I referenced, that will be available in a toolkit. Policy, so things are changing so rapidly. Know that we have at least one person in our office devoted to monitoring changes of that day, every day. And we will be publishing something on a regular basis via email, but daily changes on our policy toolkit that you can again find online. Finally, we're keeping a local business listing of all the establishments that you can still patronize on a local level through carryout and delivery. And then lastly, planning for your business. So while it's hard to imagine during the time of crisis, this too shall pass, and we want to make sure that your business is both planning for disasters, but planning for the future. So some tips that are coming out around marketing for your business in this time, disaster planning, etc. You'll get a link to each of those toolkits following the webinar. And then I want you to know that you had a few questions and suggestions that this happen on a regular basis. So we will be doing regular briefings via email to anyone that registered and submitted their email address as wanting to receive our publications. And then the gracious ladies here at the health department have committed to doing another web conference next Friday. Likely won't be as detailed of a presentation, but we want to take your questions all throughout the week as to what's top of mind for your business, whether that's operating practices or the other topics I referenced, and we'll address some of them via webcast again next Friday. So look for an invitation for that. And then lots of information. So make sure that you are getting your information from trusted sources. The health department supplied their go-tos here on the slide, and those will be emailed to you. So at this time, I'm going to pause. We have a couple minutes left in the broadcast. If we do have any questions that are coming through, let us know what else is still top of mind. I see from Denise, can any employee that works in healthcare get tested for COVID? I unmute us all, and anyone want to jump in on that?
No, they have to meet. Yeah.
Okay, so as far as testing for employees that work in healthcare, because of the limited nature of testing that is available, only healthcare employees who have a known exposure and they are an essential employee are eligible for testing. Other employees at this time. So other employees, unless they meet those requirements, are not eligible for testing. And they would, if they have illness, they would be asked to do the same things that we are asking everybody else to do, which would be to self-isolate and to just assume that they have it and to stay home until they are fever-free for at least 72 hours. And as long as that is at least 7 days after the onset of symptoms and all of their respiratory symptoms have resolved. So, and of course, this is always an evolving situation, and the guidance that we're receiving from the CDC and the Ohio Department of Health is changing every day, and the availability of testing will, hopefully increase as time passes on, and we will be able to test more people as needed. And we'll certainly keep you updated and the community updated as we find out that information.
Okay, I see a few more questions here. Veronica asking about the emergency FMLA coverage. Is it an additional 12 weeks? We are going to look into this. I don't know offhand, but what our initial interpretation has been is that it's an expansion to simply cover the virus and the quarantine versus an additional 12 weeks. But again, let's follow up on that because I don't know for sure. Randy asking about what time the webinar will be next Friday. I'm going to confirm with the team here. It seems that this hour worked well for people, so we'll be in touch, but likely Friday at noon. Look for an email on that. I see a request about getting your business added to our local listings. You can email me, the person that you received messages for, confirming your registration today to get added. Happy to do that. Any posters available to put up available from the health department. We do have a few links for that included in the slides. So certainly encourage and thank you for the interest in doing so. What else do we have coming through here? Since we are approaching 1 o'clock, I'm going to pause us there. We do have State Representative DJ Swearingen on the line. DJ, if you want to go ahead and raise your hand, I can unmute you as an attendee. He was just going to offer a brief comment from Columbus in terms of what he's hearing. DJ, you should be unmuted.
Yeah, I think, can you hear me?
Hold on. Not yet.
Can you hear me now?
There we go. People can hear. Oh.
That work? Okay. I think I just got a note from Sarah that I can be heard. Okay. Thanks, Abby. Really appreciate it. Just wanted to give a brief update to our business owners. I know there's a lot of uncertainty right now out there, and that's the last thing that those who work and own private businesses want to have. I'd reiterate a comment that was made earlier, because what we're hearing from the state is one, the importance of making sure that our hospitals, our healthcare providers, our EMA, our county EMAs have all of the resources they need in terms of equipment, surgical gowns, masks, gloves, those types of protective devices. So that's going to be really important in the coming days to make sure that they stay healthy. In a related note, part of the big push right now in taking very, very drastic measures like the governor's been taking is to keep all of our healthcare workers, doctors, nurses, et cetera, first responders as healthy as we can as we approach a likely surge in COVID cases. The concern is, and I think was mentioned earlier, that there is an uptick in these cases, and it can be very, very dramatic. At that point, the individuals needing critical care, ICU, becomes overwhelming. And like we see in Italy, some very difficult and unfortunate decisions need to be made at that point. And that is the very thing that we're trying to avoid in the state of Ohio. So that's what's being relayed on to us, from the governor's office, in working with the folks that he's working with and doing the math on the numbers and the potential spread of these cases. So that's where we're coming from. Obviously, we want to try to balance that with the economic factors as best we can, so that we keep our economy as healthy as it can be in the meantime. The one thing that I would say in commenting on the governor's drastic approach, the reason he's doing that, I'm being told, is so that we can hopefully avoid a situation where we are all quarantining, and sort of stay in place orders are given like we see in California right now. By getting out in front of it, the hope is that we can manage the level of cases to a point where we can still, still undergo some economy, and maybe it's a work from home status and it is limited, but we're not all totally shut down to non-essential or essential businesses only, and the non-essential businesses, what those are deemed to be, would be the only ones left to operate at that point. So by trying to get out in front of it, by encouraging everyone take the steps, the social distancing, to follow the directives that the Erie County Health Department are providing to us. By doing those vigorously, we can hope to avoid a situation where everyone has to shelter in place, and further economic harm is incurred at that point. That's the gist. I'm happy to take any questions. I don't have all of the answers, and I'm not a healthcare professional, but I can relay on what the information that I'm getting at the state level, if anyone has a question. Doesn't look like there's any questions so far. So.
DJ, that is a great point, though. Something I wanted to mention to close: do stay in touch with your representatives as to what would be helpful for your business, with offices like ours and the health department as to how we can be of help during this time. The good news is, as of today, 0 confirmed cases in Erie County. So let's keep that in mind and approach the situation with calm, confidence, and then disciplined approaches in our workplace to ensure that that continues to be true. So thank you, everyone,
Abby,
for your time again today. Send us your questions. We will field those via email and put together responses. In the interest of time, we'll wrap up right now, but do email and send your questions. We welcome them. So anything else from Abby and Heather? And a big round of applause to everyone who put in the work for this presentation at their department.
Hey, Abby.
Okay. Thanks, everybody. Have a great weekend.